So, hi, Kingsbridge members. I am here with Gillian, who is a nutritionist and dietitian.
Yes.
Gillian, thanks for joining us today. I'm going to start with some generic questions because we've been talking about gut health a lot this month. So, firstly, why don't you tell us a little bit about yourself?
Well, I qualified in 1997 with a master's in human nutrition and dietetics, and that was in Northern Ireland. I had previously been here doing research into heart disease in 1993, and I then decided to come back here, and I got a job, and since then I've been working in the NHS and also then privately doing my own nutritional consultancy work.
Okie doke. So what do we mean when we're talking about gut health? What is that?
Yep, so gut health is a massive topic, and it's really become very prominent in the last number of years. Lots of people are very focused on their gut health, where before it wasn't really something that people had considered as part of a health and wellness strategy. But your gut is made up of 1,000 trillion different microbes, which are different bacteria, viruses, and they actually need to be balanced. And when they're balanced, your good bacteria will allow you to feel well, healthy, and make sure that you have, the right components for good quality gut.
Oh, okay, yeah. How do you know then if you've got an unhealthy gut, if you've got the bad bacteria?
So there are a few different signals, certainly at the beginning stages when your gut bacteria can break down or be dysbiose, which is where your levels of good bacteria and bad bacteria are not in harmony with each other. That can come from a variety of factors. From young, even after being delivered, you will find that babies can have gut dysbiosis for a variety of reasons. Right. But as we age, we're always living with different things that come about in our daily routines. We get infections, we might get hospital admissions. And so you might find that after you've had antibiotics, your gut doesn't just feel so good. And some of the symptoms might include reflux. You might get some feelings of after you've eaten, you just don't feel like everything's digesting well. You also might feel like you've got stomach pains, and that they're crampy rather than any other types of symptoms that you can get pains with. Some people get bloated, they might get extra wind, diarrhea, constipation. There's quite a lot of different signals that you can get when you have a gut that's just not in harmony with itself.
And so the day-to-day can affect your gut?
Absolutely. Okay. The way that you eat as well, what you eat. There's so many different parts to that.
We hear a lot of the terms IBS and IBD. What's the difference?
So IBS is actually a functional disorder. So it's not actually where we've got inflammation of the lining of the gut, which is what inflammatory bowel disease is. IBS is a syndrome, and irritable bowel syndrome can come and go, actually. It's something that some people can start off having small minor symptoms like I mentioned, and then they'll disappear and they'll come back, and they're really confused because they can't pinpoint what the specific trigger is. Whereas inflammatory bowel disease can be triggered off by autoimmune issue. It's an autoimmune condition, so it can be triggered off by stress, it can be triggered off by an infection, it can be genetically linked. So there's a few different variations in what IBS is to what IBD is.
Okay, that clears that up. And what about the connection between, you hear often about the connection between your gut health and your mental health. What is that?
Very much a link there, and interesting because a lot of patients historically would never consider their gut health when they go to see their doctor. They go for an appointment, the GP will talk through all the different things, and then a medication will be prescribed. And we know for a fact that our gut health, if it's not optimal, really impacts on our serotonin, and it's a good mood hormone, and our GABA, which is an amino acid called GABA aminobutyric acid. And that is really important for our neurotransmitters that signal from the gut to the brain. And when they aren't working properly and our GABA gets dropped because we don't eat well or we don't sleep well or we've got stress, then you can really have a negative impact on your not only mood, anxiety, but depression as well.
Okay, thanks so much about that. So we asked our members some questions and we had some responses. So if you don't mind.
Not at all.
This one comes, this one person says, I've had bowel problems for years, but in the last few weeks, I've also had some pain on the upper right of my stomach. The last few days, I've noticed that I have really bad breath. I haven't changed my oral hygiene habits, brush, floss, use mouthwash twice daily. Is there any chance it's connected to my bowel issues?
Good question, and certainly something to investigate more. It can be for a variety of different reasons that someone can have a sensation of bad breath, gut discomfort, upper pains. You would be wise to, depending on your age and if there's been any other kind of areas that haven't been included in there, like weight loss, definitely going to your GP would be the first port of call just to discuss it. But you could have simple infection, it could be linked to a gallbladder issue. You could have dysbiosis, like we mentioned about the IBS. Certainly, I would be saying that, interesting using mouthwashes. That is an area that people maybe aren't acutely aware of. They can be beneficial, but they can also destroy your gut bacteria.
Really?
So something to be mindful of if you do a lot of mouthwashing.
Yeah, you can overuse it.
And destroy your gut bacteria. You've got good mouth bacteria that you need to be keeping happy and healthy as well.
And so that's natural mouth bacteria.
Yes, okay. So, and that's where people have maybe issues with bad dental hygiene or bad teeth, and then the bacteria can get through those areas and then actually can impact your heart health as well as your gut health.
Oh, that's so interesting. Okay, thank you. This person says, I started getting hemorrhoids during pregnancy. I've never had them before. I still get them now. My child is 4. I've lost all the baby weight and I'm otherwise back to my normal healthy self. I use over-the-counter creams, but it's a reoccurring problem. Is there a reason for this, and can I get rid of them permanently?
So, yeah, interesting question as well, because very upsetting, very uncomfortable. Having a child at 4 and still having hemorrhoids would signal that they would need to be thinking about other parts of what's going on in their world. And I definitely think going to, first of all, GP just to rule out anything in an area that could be fixed, but also looking at diet. Some people just naturally are not appreciating that their gut might be sluggish.
Yeah.
And if you've got a sluggish gut, you could have a constipation, and constipation pushes more on the abdominal bowel, colon, and then pushes obviously out of and protrudes, and that's where you get your hemorrhoids from. So again, fluids, exercise, good diet could all play a really nice role in that, but certainly you wouldn't want to be leaving them and feeling uncomfortable. So I would definitely go seek advice as well.
Thank you. This person says, my mum has suffered all her life with Crohn's disease. Recently, I started getting a really sore tummy, cramps all the time, and regular bouts of diarrhea, and I'm exhausted all the time. I'm 42 and have been completely healthy until now. Could this be Crohn's? Is it genetic?
So very worrying for that poor person, and certainly right to be investigating and thinking about what it could be. Family history, for sure, we know genetics does play a role, and anywhere between 5 to 20%, if you have a family member, close family member with a autoimmune condition, you are potentially at risk of getting the same. We also know that autoimmune disorders actually cross over, and you can get polyautoimmune. So some people get a few different autoimmune conditions. So really important that you rule that out. She could also, or he could also be suffering from a simple infection that's ongoing, but unlikely, seeing as they seem to be having it for a while. You'd also want to be ruling out celiac disease, which is another, as I mentioned, autoimmune disorder. Could be even things down like IBS, which is the irritable bowel syndrome, which is a functional gut disorder. So again, needing a different avenue of treatment. So going to see GP first line and then getting referred to someone like a gastroenterologist might be really beneficial.
So it could be a number of things.
Could be
Crohn's, but see somebody.
Could be, needing to be looked at. Bloods could be done. Scoping can be done. So there's quite a lot of things that are well worth investigating.
Brilliant. Thank you. Speaking of celiac, I've just been diagnosed with celiac disease. They did a blood test and I had to wait weeks for the results, but I've heard nothing else. I was told to cut out gluten, but I've had no other information. What should I do next? I've already started cutting out gluten, but it's a big learning curve.
So it's actually with COVID, there's been a real kind of knock-on effect of testing, and then you actually need to get scoped to rule in or rule out celiac disease. You get a blood test, which is your antigliadins, and that can be proven that you're positive to celiac disease. But actually the gold standard is to go and get a scope done. And what can happen is you do need to have a lot of gluten pre your blood test to prove it, but you also need to have gluten in your diet prior to the scope. So what can happen is people end up getting told they've got celiac disease on the blood, and then they take their gluten out, and then the scope comes back and there's no conclusive evidence. So you do need to be really mindful that you get the right testing, stick with the gluten, even though it may be something that you're really scared about doing. It's for a couple of weeks, and then you can prove that you've actually got celiac disease, get the biopsy, say that's confirmed with a gastroenterologist, and then going forward, you need to be very strict with eliminating gluten. And that becomes really, I suppose, for a lot of people, very limiting. And it shouldn't be. Being gluten-free now has become so
there's so many options out
available. So it's making sure then that they actually fine-tune things so that when they're out, they can order from the right restaurants and they're confident that those people are cooking the foods in a separate environment. You're not buying foods that are, let's say, behind a deli counter, and even though they look like they're separate, the knife can be used. So again, there's cross-contamination. There's lots of different little small things that people need to be very mindful of when they're looking at being gluten-free. It's not only just taking the breads out. There's a lot more in terms of
treat it similar to an allergy, or
very much so, because if you have gluten in your gut and you actually don't get symptoms, it can be really hard to know whether you're getting what I call glutaminated, but it takes quite some time for the body to
it builds up.
It takes about 6 months for the gluten to actually be passed to stop the villi from being damaged. So when you get a damage or an insult to the villi, it takes a while to get them back to where they need to be. And understandably, if you're doing insulting the gut lining with the villi, you are at risk of other longer-term health issues.
So this person's victim to waiting lists.
Possibly. So yes, maybe you need to speed that up with a scope with a gastro and get it seen once and for all.
Perfect. This person says, also celiac, said it's a weird one. I appreciate if you keep me anonymous. We will, of course. In my teens, I was diagnosed with severe depression, which I've kept mostly under control with medication. I'm now in my 30s and I've been recently diagnosed with celiac. I've always had bad guts, but never got it checked out. Is there a chance celiac has exacerbated my depression? Is there any links to that?
There is actually, purely because if you think of the fundamentals of how celiac disease is in the body, it is autoimmune, so it's the body attacking itself. And the attacking mechanism is gluten, and gluten is going into the body. The body's not recognizing it as a friend, so it's wanting to attack it. And what gluten then will do to the lining of the gut is, as I mentioned before, we have these villi, which are finger-like projections in the lining of our gut. And if they're blunted, which is what happens in celiac disease, we don't get that multiple absorption capacity. So we're not absorbing our micronutrients like iron, vitamin D, calcium, vitamin A, D, E, and K are fat-soluble vitamins. Vitamin D is an immunoregulator. It's so important for brain health, gut health, inflammation. So if you've got chronic inflammation, you're not absorbing things like iron, you're not making serotonin. Serotonin is an immunomodulator. It's a neurotransmitter, and it's really important for mood, as well as serotonin and GABA. So if you don't have them in the right amounts, then depression is linked there. So not only are you low in micronutrients, potentially macronutrients, if you're malabsorbing, you're then having that knock-on effect of not having good gut chemistry, linking to the brain, and depression, fatigue, low vitamin B12, low iron, they linked to fatigue. Also low folate not being absorbed, that's linked to mental health as well. So huge numbers of synergies that you need to be mindful of when it comes to gut illness and how the brain and gut work.
I would never have thought there was a connection. That's so interesting. So this person says, I'm a woman who really struggles with my weight. When I was a teen, I averaged around 8 stone and generally felt good about my shape and body. Then something changed in my 20s. I can't seem to maintain a healthy weight. At my heaviest, I was 14 stone. She says she's 5'4". I managed to get that down to 10 stone with diet and exercise, but I've not been able to maintain or get any more off. I'm up and down all the time. It's really not my confidence, but I just don't know where I'm going wrong.
So a big question, lots of avenues to consider. For sure, females are at the mercy of hormonal imbalancing. We can have so many different factors and be advised so incorrectly and follow the wrong advice for our body types and our health. So genetically, we can be predisposed to, the way that our gut bacteria works to make sure that we are hormonally balanced, which is another whole fascinating topic that I certainly work on for patients in my clinics. And certainly for someone like herself, when you do start to worry and become anxious, that also changes your cortisol level. And if you've got cortisol, that's causing you to be not following your circadian rhythm, not getting into a deep sleep, then you've got this level of ongoing kind of trickle. And that then also impacts on the way your body works, and you're in this fight and flight zone. So you're not actually in your repair, digest, parasympathetic state. So then that impacts on the way that your body works, because it's putting a handbrake on, saying, we're not ready to rest and digest, we're ready to fight. And so a lot of females get into that stage where they cannot actually switch their body into a nice rest and repair. And that really then holds weight in that area. Now, that being said, you also need to check what diet she's following. A lot of people go down the route of, I need to go keto. I need to go carb free. I need to, make sure that I don't eat any proteins. And they're all messages that get misconstrued and actually become inaccurate for that person. And I see that a lot. Ladies getting up in the mornings, they're working out at 4 a.m. They think they're doing the best thing they can. And actually that's a cortisol zone time where, they really need to be asleep and repairing. So again, it's all about factoring in what they're doing, what their lifestyle's like. Are they under stress? Have they had hormonal imbalances? Are they living in a world of cortisol and not being able to, get into a nice level of rest and digest, and then eating well, getting good gut bacteria balance. So again, lots and lots of things to think about.
It's so easy to get fixated on the diet and exercise, but there's obviously the big picture there as well.
Absolutely, for sure. And if you've been ill, I'd be looking at bloods, making sure they were optimal in thyroid, in vitamin and mineral statuses. There's, plethora of things that you can do under the bonnet. I tend to take people and take them like a jigsaw puzzle. So there's lots of pieces, and I put them all back together again. So
very good. Well. This person says, I've been losing my appetite slowly but surely over the last couple of years. I can easily have a slice of toast in the morning, nothing all day, and maybe a light meal in the evening. I don't feel hungry at all in between. I wouldn't mind so much, but it is sort of upsetting me when friends go out for meals together and I just don't want to eat. Is there something sinister going on?
So for that individual, I'd really want to get a really good understanding of the background to that. Was there a trigger? Is there an emotional attachment to that? Is there an eating disorder? Have they lost weight with this? They're obviously concerned. So there's some acknowledgement that they're not doing what they're meant to be doing. But some people drift quite unbeknownst to them when they're under a level of stress that they stop eating. And we've got lots of different hormone signals in our gut for, saying we're full or saying we're hungry. And sometimes you can really impact those. And then they almost don't know how to switch them back on. And that's what you'd really want to be addressing. But definitely seeing a GP, going through any of the red flags. Has there been weight loss? Has there been any additional problems with pain? Or why are they not eating? Why do they feel full? There can be other things that you'd want to be looking at.
Okay. What can I do about excessive flatulence? I have nothing else wrong with me. I don't think they have anything wrong with them, sorry. But for some reason, I'm constantly gassy.
So again, that can be a dysbiosis, gut bacteria just not in harmony. We have, as I've mentioned, thousands of bacteria in our gut that we know of. And there's two different subsects called, they're phyla, and they are firmicutes and bacteroides. And we don't want all the firmicutes taking over the bacteroides. These are the ones that we want more of. And we are very prevalent to the way that we eat to get a dysbiosis, plus our antibiotic use. People, with maybe drinking too much alcohol, caffeine, they can all really interplay with that gut.
Yeah.
And the person mentioning it being gassy, they could also be functionally not doing the right thing, and they're eating too fast and swallowing a lot of air. So there's a few options that they can think about. They mentioned they've got no other symptoms. I would probably be quite sure that when you question them, they may have a few
something
more.
else going on. Yeah.
But the gassy side of things would be indicative of a functional dysbiosis to begin with. So looking at that, checking what they're eating, making sure that their diet is balanced, getting more nutrient-rich choices. Fibers are really important. We know fibers feed our good bacteria, and we've got these short-chain fatty acids. The three most common ones are butyric acid, acetate, and propionate, and they are so important for immunoregulation, for gut bacteria to feed off. So once you get all those in place, the gas would be kind of hopefully alleviated. If not, it might be an infection like Helicobacter pylori or, other areas that would be worthwhile having a look at with the GP.
Okay, thank you. I mean, we've sort of touched on this, but what really is the best way to lose weight? I'm sick of all the diets.
Yeah, good question. And I'm also sick of all the diets. For 30 years, I have been inundated with the cabbage soup diet, the Atkins diet, the very, very low calorie ones, which people love to come and say, I'm on a 500 calorie restriction. You just think, no, it doesn't mean calories are what you should be looking at. And actually, in my career, I steer people away from macro counting and calorie counting because you can meet your macros quite happily on the biggest load of rubbish. Doesn't feed your good bacteria. You get depressed. Your weight drops off. But actually, if you're dropping weight really quickly by being on a very low calorie diet, you're also getting rid of your muscle. And your muscle is the critical part of metabolism. So
Slowly
if you're doing a dramatic weight loss, you might get some success and then the handbrake comes on. So ultimately, the best way to try, if you've got weight to lose, is to think about it on the long term. Make sure that you've got several months to think, right, this is going to be a slow, steady progress, and then follow a plan, get some results, take on some extra exercise, do it over a gradual period of time so you don't injure yourself, because so many people are great at jumping into, I've got to stop eating, I'm going to do loads of exercise, and then they injure themselves, and then the vicious circle comes about, and then they get depressed because they're not getting the results that they need. So slow, steady, and doable, affordable, achievable. You can still go out and eat with your mates. You can still go on holidays. You can still go to parties. That is what life is all about. So if you try and take yourself away from that and be super careful about what you're eating, there's no fun. And then you then give it all up.
You're setting yourself up for fail. I think we've all fallen into that trap one time or another.
Certainly.
This is the last one. I suffer from horrible bloating after every meal. I had a colonoscopy a while back. It was all clear, but I'm having issues with bloating and constipation. What would you recommend?
So back to the areas of there can be many different factors. You can never rule something in or out just by a couple of symptoms. So it's really worth investigating in more detail. And I get all my patients to fill in a questionnaire just with their background data. And then they get to fill in a food diary, symptom diary. So they might not see things emerging out of that, but I would instantly be tracking and looking and making sure that there wasn't anything else. Once you've ruled out anything suspicious or anything that could need further investigation with your GP or gastroenterologist, then you're looking at maybe, again, is it an infection? Treat that. If not, then it's the functional side of things. So maybe a bit of IBS is going on there. Again, you'd be looking at making sure that you're feeding your good gut bacteria with the high fiber foods, the polyphenols, which are your fruits and vegetables. We know the Mediterranean diet is great for gut health. So if you've got a bit of constipation, you'd want to be assessing whether your diet is formatted from processed beige choices. Are you getting enough variety? Variety is the key to getting good gut bacteria.
All the colours and all the different fruits and veggies. And
very much so. And then proteins, important too.
Brilliant. Thank you so much, Gillian. Do you want to tell everybody how we can book with you?
Yep, so you can get in touch with the Kingsbridge team through the Contact Us page, or you can certainly come through to my page as well, which is One-to-One Dietitian.
Brilliant. Thank you so much. Thank you.
No problem.